serve God. So that's the reason why you want your blood pressure controlled. You don't want to have a stroke. It's not about your mama. It's not about your kids. It's not about the money you're making. It's not about your job. And they listen. That's about it. The other thing is, based on that motivation, change your ways. Very simple things. You know, it doesn't have to be mind-boggling. You can start with going for a walk 30 minutes a day. You know, it's overwhelming. America and our lifestyles has become very overwhelming. And so we're unable, we want, I think a doctor who says, hey, you gotta lose weight, or, you know, it's gonna throw a lot of issues at the patient. What I suggest to them, just pick one thing, get it right. I am not going to eat fast foods again. Change one meal, make it salads. Just do that for 1 year, 30 minutes of walking. It is astonishing how much data there is out there to show that this can prevent diseases. The most important thing is, what's your state of mind? I mean, what do you actually believe? What gives you peace of mind? And I think we are driven, our physical bodies are driven by our spiritual bodies. Of course, if you told me to have this conversation 20 years ago, when I was in the Bronx, I worked in ER, I wouldn't be talking about God. I wanted to fix it all, but God has seriously humbled me. Humbled me as in, you know, I've prayed for people to live and they've died. I have prayed for wisdom on certain things and it didn't happen. I think what God was trying to teach me as a physician is that you've got to change within yourself before you can start preaching about these things. And so I think my personal journey has a long way to go, but because 90% of what I do is talking to patients, I find myself talking to patients a lot about what I think is going to help them. That's about it.
You could go on forever, and that's wonderful. But let's go to the next person. Thank you, Shiva.
Exactly what I was going to say. I agree with everything he has said. Lifestyle changes. I mean, I hear it all the time from my wife. I don't ask her what's for dinner. I ask her what kind of lettuce she's using. I'm going to take a little different approach, since this approach has been covered very nicely. I won't get near it because I don't think I can do it as well. I'm going to take what I want my patients to know. There's two factors here, medicine and disease. A lot of patients come in, they want their pill to fix them, and out the door they go. They don't understand why. Very frustrating. I say, what pills are you taking? I'm taking the little green pill, the little orange pill. You know, people have to take charge of their own lives. They have to know what's going on. They have to know what medication they're taking and why they're taking it. It's frustrating for a physician to try to heal people in the amount of time we have. I've been through a lot of, I did a lot of hospital work, then mainly now it's outpatient work, and these patients, I deal in downtown Baltimore. Some are pretty good, some need a lot of help, but I think each patient should realize the physician is there not so much to treat them, but physician is a teacher, to teach them how to take care of themselves. Teach them about their diseases so they can control it themselves. A diabetic should know what happens when they're feeling dizzy and lightheaded, or all of a sudden they're urinating too much and drinking too much. That happened to my cat, but he didn't know anything. now I give him insulin. Okay, but this is what I say. Patients must know their medicine, must know why they're taking their medicine, and know their diseases, and what makes them better, what makes them worse. I really had a lot of trouble getting someone's cholesterol down, piled on the medication, until his daughter revealed something. 3 scoops of ice cream a night? Yeah. Oh, a great patient will keep me busy for a while. So that's a very important factor. The other factor is the patient has to be honest with the physician. I have patients who come in I had one, and I'll tell you what happened to him, but he always said he took his medicine, his blood pressure was high, kept on piling on the stuff, minoxidil, all the real complex medicines. And one day he wasn't feeling well, because he never took his medicine. He came in, his pressure was high, gave him more. Pressure's high, gave him more. What's going on? Ran a lot of tests on him. One day he wasn't feeling well, so he took all his medicine at once. Well, now we can go and pray for him at the graveyard. And that's what happened. Passed right out. And this is a problem. You have to be honest and work with the physician. You can't come in, I took my medicine, you really didn't take your medicine, or you don't know what you're taking, you just pop them. And you're right. Lifestyle changes are very important. Work that with medication, because some people, genetics are important in some stages, but your disease process is controlled by hereditary and the environment. And the environment means what you're eating, what you're smoking. So that combination is very important to look at. If you do that, you'll be better off with the lifestyle changes, knowing your medicine, knowing your diseases, and how to take care of yourself. You're here to learn from the physician. And he cannot do miracles without your help.
Okay. So I guess my approach is once you decide that you're not going to handle the lifestyle issues, then you just have to come in to see me. So I think maybe, yeah, so I think my approach will be just maybe, since I'm in the field of emergency medicine, what to expect when you come to an emergency room, and maybe have an understanding on what is in the mind of an emergency doctor when you come to see an emergency doctor if you think you have an emergency. So obviously, generally it's very busy, and when you come in an emergency room, obviously most people know they probably have to wait, because we generally triage patients and try to take care of the sickest patients first, and then if you don't present with a complaint or a situation that you're not so sick, then generally you'll have to wait. That's kind of the first thing. The second thing is when you go to an emergency room, the expectation is, so let me put you in the perspective of an emergency doctor, is that basically I'm looking for something. If you're very sick or if you have a complaint, I want to make sure, I'm really thinking, I may not know exactly what's wrong with you, but I need to know what it is not. So, and that's kind of, we don't really want to know what, as emergency doctors, we're not like internal medicine doctors. We just want to know, do you have an emergency that I need to take care of right now, put you in the hospital, or can I send you home and let one of the primary care doctors take care of you? That's really what's on her mind. And so you kind of have two avenues. Can I treat you, send you home, or can I run some tests and figure out, is this not a very bad thing? Because there's a lot of bad things out there for you, and different presentations present differently. So in my mind, mostly, I want to know, are you having a stroke? Are you having a heart attack? Are you having an infection that can overwhelm you? And so we're thinking of those things. And if it's not one of those things, then most likely we're going to send you home. If we don't think there's a risk with you, either it's a risky situation where you might deteriorate, or you might, or it's something that we need to fix inside the hospital. And that's kind of what we think. And so the reason I say that is because sometimes, we'll have a patient, for instance, will come in with abdominal pain, and we'll do the whole workup and do a CAT scan, and CAT scan doesn't show anything. I said, well, what's wrong with me? He said, well, I can tell you what it's not. I can tell you it's not an appendicitis. I can tell you don't have a bowel obstruction. I can tell you that a lot of other things medically that I would be worried about, and a lot of times there's something called unspecific abdominal pain. We don't know what it is. And it might take more testing that we don't do in emergency rooms. So we'll send you back to your primary care doctor. Maybe you still have a little bit of pain, but we're pretty confident that this is not something that you're going to have a deterioration within the next couple of days. So we'll send you to see your doctor to see if your doctor can figure it out. And that's kind of basically what you're going to get in an emergency room. Now, if you're having pain or some things, we try to figure that out. We kind of risk stratify you and say, okay, we can get you under control and that. But a lot of times we don't even know what's causing the pain. But we know it's not something that's, terrible that you can deteriorate within the next couple of days. And that's kind of the way emergency doctors think about things. Is this something that could kill you, or can you be very sick within the next 24 hours, or is it something you can go home? that's really, and so we, today I probably took care of 30 patients. And so you have to keep moving. There's a lot of people coming in. People don't like to wait. No one wants to wait anymore, which I completely understand because I personally don't like to wait. And so there's a lot of emphasis on moving patients through quickly and effectively. So it'd be unrealistic to think that you're going to be able to come in and speak to an emergency doctor and have them sit at your bedside and speak to you for 30 minutes. That just is not going to happen. So we're like...
It's not like on TV.
It's not like on TV.
When they come in and treat you and put you in and then send you home, say, healthy and everything.
That's correct. And
After
so,
they've treated your thyroid problem.
that's exactly right. And so it'd be unlikely you're going to get a tremendous amount of time from an emergency doctor trying to figure things out. We're going to say, okay, this patient's not sick, so we're going to prove that you're not sick and we're going to move you along, or you're sick and we'll have to spend some more time, or maybe you're very, very sick and then I'm going to have to spend a lot of time trying to get you stabilized. And so that will prolong your wait time. So one thing I can also say is you can be sure that we're not, the wait times are for a reason because it's not like a fast food restaurant. Sometimes it takes a lot of time to figure things out. And so I might be with the sickest of the sick patient. I could be with a child. I could be with a pregnant woman. And so that's why you see a lot of delays, because things can get complex. And we recognize through a triage process that, yes, you might be outside for a long time, but sometimes we kind of know what's out there, and usually we get it right, who needs to be seen right now and who doesn't. And hopefully that's been informative to everybody. Okay, I hope that was good. Thank you very much.
Okay, I don't want to take much of your time, so I write down a few notes there that I can share with you. Starting in the 1990s, there have been a big change in the practice of medicines in the United States with what we call alternative medicines. So I would like my patient to be aware of what they call alternative medicine. Also to be very leery about all of those propaganda about organic product, and also the snake oil that can treat everything. And they give you that with the propaganda of cell technique, nice speech. But when they start talking about alternative medicine, that became very popular when the Congress, through NIH established I would say a bureau that was supposed to do research on what they call the alternative medicine. What do we call alternative medicine? We have the mainstream medicine, which is what you learn at the medical school, at the university, which is the scientific-based type of medicine. And also, the public have been going to visit other practitioners that can offer them a lot of other type of treatments, such as acupuncture. They have to go or the doctor called homeopathic practitioner. And of course, you have the chiropractor, we have osteopathic medicine, and also you have a lot of type of practice that's offering well-being to the patient that come from the Orient, from the Buddhist world. And for example, from India also, we have what they call the Ayurvedic medicine. And when you go to a country like Haiti, or you go to Africa or Australia, you're going to find what they call shamanic medicine. And you find that also in Mexico. So those people have a knowledge of herbs that we call botanical, and also they have other idea about the composition of the human being, that we are not simply a physical body, we have also what they call etheric body, associated with your body, physical body, they have, they said you have two souls. One is very subtle soul, another one is very, very subtle soul. And they have mean to approach those part of you when you are not well, because they said if you can influence those other part of you, then you can get well. Now, so this is what a lot of people don't realize, is that those techniques they have not been studied, the way we do in or conventional medicine, the Western medicine. So like that, the NIH start doing the studies, and they have found that some of them can give some good result. So, and then they come with the idea of what they call complementary medicine. In other words, with our Western medicine, in some situations, they can add one of those alternative medicine. For example, they can recommend acupuncture, for a patient. Now, in some centers where they're treating cancer patients, for example, with some of those medication that can cause a lot of side effects, some places have a acupuncturist on staff that can help those patients with this type of thing. So now, with the alternative medicine, we have other terminology that came, such as integrative medicine, that you're going to integrate some of those alternative medicine with your academic, conventional treatment. So but at any rate, we have to be very careful, when we see those practice becoming very, very popular. For example, recently there has been an argument in Maryland about the MedChi, which is what licensure in the practice of medicine in Maryland. They've been somewhat against the group called naturopathic medicine, practitioner. Those naturopathic practitioners, they don't really do anything to harm the public, but our academic medicine here is very leery about many of the things that they are professing. For example, the naturopathic medicine studies some of our academic, medicine. They have knowledge about internal medicine, they have some knowledge about obstetric, they have knowledge, about, pediatrics and so on. But also, they want to practice what they call the holistic medicine. A holistic medicine that use not only our academic form of medicine, but also all of the other things that come from Asia, from the Orient. They want to use things like the acupuncture. They want to use other yoga, for example. They want to use knowledge about the energy part of yourself. For example, then when you go to an acupuncturist, he's going to insert a needle on your skin, and that needle is supposed to be connected to what they call a channel. That channel is going all the way to the center of yourself, which is your spine, where they have some area they call chakra, and those chakra are some kind of wheels of energy that is connected to those channels. And now, by using the needle, they can influence this energy center in order to make you well. Well, so all of the study that we have done in the West to try to discover what really is the that energy is, but they can't find anything. It doesn't correspond to any anatomical aspect of our being. So now the other thing also that the patient should be aware of is what they call the natural product. They will always offer you things that are going to create miracle, bring you your youthfulness. You're going to be, for example, the men who has problem when they get older, they have some problem with the prostate, or they have herb that can bring back the youthfulness in you. But you can lose a lot of money following buying those things that in fact doesn't give you much good result. So it is very important also to know that there was another school of practice medicine, which is what they call the homeopathic medicine. The homeopathic is very interesting field in the sense that at one time in the United States, actually at the end of the 19th century, at the beginning of the 20th century, the medical faculties, the medical school, were somewhat lenient as far as the homeopathy is concerned, but after a while, they discard themselves from the homeopathy. The homeopathy could take a substance and dilute it 100 times, 200 times, 1,000 times, and then what remains in that liquid, we don't even have one molecule of the original substance. But now, they're going to give you that liquid to treat certain ailment. And if you analyze that, you don't find any, any molecule